It has been 43 years. There are no new antibiotics in the world. We all are in a big soup. The problem is serious in every hospital around me, not only in Indian hospitals, all over the world. A brilliant solution to this problem is in your hands though. A November 2022 study published in the world-renowned medical journal Lancet showed that antibiotic-resistant superbugs have emerged as the second largest cause of human death. At a young age, we took antibiotics for no reason and did not finish the course whenever we want to. Then when we grow old, when antibiotics are really needed, antibiotics no longer work. As bad as it sounds, our health is a market commodity today. Usually, if the market is good, then drug companies jump in. Cholesterol drugs, diabetes drugs, just think, there are no shortage of drugs and companies. Yet, despite the demand for antibiotics, why are the companies silent? So much new research is going on all over the world. Technology is improving by leaps and bounds. Today, we get closer to the moon, tomorrow to Mercury, and the day after to the sun. It is suspected that artificial intelligence will come and even write basic essays in schools. However, no new antibiotics could be found. There are almost no new antibiotics on the horizon even. Why is science abandoned the search for antibiotic despite the looming threat? 7 out of 12 top companies in the last century that made a splash with antibiotic research are bankrupt today. The big names are in the medical research line are reluctant to invest money behind the research of antibiotics. But why this kind of misery? Meanwhile, drug-resistant bacteria are skyrocketing. The future of billions of people is very uncertain. What is the reason? Here are top 5 of our misery and how we can get rid of it. 1. Cost and law. 2. Fussy Bacteria. 3. International barriers. 3rd, phase research. 5th is side effect. First, cost and the law. Finding new antibiotics or any medical research are not a child's play. To discover a new group of antibiotics, it takes at least 10 to 15 years of tireless research. The thing about research is that there are more failures than successes. Out of 500 research chemicals, maybe only one may show some promise of becoming an antibiotic in future. Sometimes the whole research goes into toss. The cost could be $1 billion or more. 1 billion means 1,000 millions. To compare, the declared cost of Chandrayaan-3 is only 75 million. So what? Private companies deal with even bigger financial risks. But why they have lost interest? The reason is simple. If there is an antibiotic discovery, it will be preserved so carefully that perhaps WHO or all the responsible countries of the world will impose restrictions on it. Why so? Just so that the new antibiotics use stays strictly limited. When a new antibiotic is introduced, some bacteria will invariably become resistant to that new antibiotic. Its sale will be strictly controlled so that it can continue to serve the people for decades to come. So when a new antibiotic comes out, there is almost no chance of it being sold on the open market. There are always ways to find financial gains from those things which sell very little. Price has to be set too high. Simple. For example, take the car company Ferrari. They don't sell much. Price is high. Problem there too. For the sake of humanity, there will be pressure on companies to ensure that the price of new antibiotic never rises above a certain level. If the companies refuses to listen, the world has the legal means to force the companies to keep the prices and levels of such life-saving drugs within limits. All fair, isn't it? Price will be less, fine, wait. During the preceding 15 years of uncertain drug discovery, who paid the salaries for the famous scientists, junior scientists, clerks, security guards, and thousands of other staff of the research institute? The companies did. For the past 15 years during the research, who has been paying for laboratories, electricity, and air conditioning costs? The company did. How can the government now prevent the drug companies from recouping their costs? No one has any answer. Number 2, Fussy Bacteria. Before testing a research chemical can be the antibiotic, it can first be applied to the bacteria outside human body. Hundreds of chemicals cannot be injected inside our body in the name of the research. It is tested on bacteria on culture media in lab. Media is simply the food for bacteria. Only a small fraction, less than 1% of hundreds of types of bacteria in the world can be cultured in a lab. Bacteria can be very demanding. Some desire Komodo dragon blood, others seek ant body parts or armadillo foot pads to thrive on as their food, Sometimes the bacterium demands that the person's nose will be torn off for their food. They do not eat any other media except the soft tissue inside the nose. Such research is quite difficult. Just dollars cannot buy it. Number 3, international barriers. Even with the discovery of new antibiotics, gaining permission from different countries can cause significant delays. Until then, the company cannot sell their new drug. Why is that? We are no longer living in the days of World War era. That time when people learned that an antibiotic has been discovered, i.e. penicillin, they started giving them to patients. The days have changed. Science is now pushed by the rules. Until FDA approval is obtained, America refuses to provide antibiotics to its people. Different rules exist in Europe, different rules in England, different rules in India, different rules in Japan. It is not the doctor's job to cut through these fences. So, not only scientists, these companies have to hire legal experts and public relation officers who will journey worldwide to secure the antibiotic permissions. This is a costly affair. Companies are lagging due to cost concerns as well. Number 4, third phase research. New drug discovery goes through 4 phases of researches. 80% of the entire fund is spent in the third phase. After antibiotics are discovered within the glass walls of the laboratory, this phase of research that the medicine is tested on large population. This is to check its effectiveness and side effects. This is known as third phase research. Many times it comes with various legal complications. If there is a litigation, it takes more than a few decades to settle it. The future of this medication till that time remains uncertain and cannot be sold. Let me give you a simple example. This has got nothing to do with antibiotics though. A few years back in India, during a cervical cancer research vaccine, a vaccinated girl died of gunshot wound, a freak accident. The whole research has to be called off. Why? If a patient dies during the research, no matter what the reason is, the onus is on the drug company to prove that the patient did not die out of new drug. Such is the legal thrall in these days that average scientist is scared away. They do not want to do any researches. In the end, India found out that the girl's death was not because of vaccine after long investigation by Joint Parliamentary Committee. By that time, however, thanks to the research in Brazil, the vaccine had been launched all over the world. Therefore, despite the legal setback in India, the triumph of science did not stop. Not only in India, this outage can happen in any country of the world. So, it is seen the people's own rule created for greater good are pushing people towards the uncomfortable destiny. Number 5, side effects. First, if a chemical is found that kills bacteria but not humans, that chemical may have the promise of becoming an antibiotic after the research. The story does not end there. It begins here. The side effects remains to be seen. It is not just vomiting or gas, but many other things. Suppose a woman who takes medicine today, when she becomes a mother, science is to check if the newborn develops any side effects or not. So, this research goes on for decades. If the beneficial effects exceeds the side effects, the medicine is then approved. So, are we destined to lose human lives in the hands of this tiny little drug-resistant superbacteria? The fear is not unreasonable. You are right. People take frequent antibiotics for cold and flu. Flu is caused by virus. Antibiotics have no effect on viruses, but with the unnecessary antibiotic, we are generating antibiotic resistant superbugs in our whole body as we move around. If you want to get the benefits of the antibiotics when you reach 70 years of age, or your parents reach 70 years of age, you have to be careful now. Start alerting everyone. It is not known when a new antibiotic will come, dodging the international politics, but we must have to stop taking antibiotics except in life-threatening situations, so that the current existing antibiotics remain effective for a few more years. It is not nice experience either for the patient or for us, the doctors. So be aware from today. Keep an eye on this channel to know how your country's government and your family's school-going children can help the world discover new generations of antibiotics. I'll be back with the story shortly. Thank you for joining us.